everyone. It's Friday and we are here with Mom Talks. Thanks for coming along with us. It's October. It finally feels like fall out there.
Yes, it does.
You can't see it, but there are Halloween decorations all over the place. So before we get started, because I do not want to leave this out, this is going to be so much fun, I do want to remind everyone that St. Louis Children's Hospital is hosting Pumpkin Wars this weekend. It is this Sunday from 1 to 3 at the Interior Design Center of St. Louis. So 6 of our fantastic surgeons, some of you know them, they're really great with their scalpels, but we're going to put them to the test with Halloween carving tools. And so they're going to be going head to head with some area chefs, and we're totally going to win, and it's going to be so much fun. But there's going to be all kinds of activities. We're going to have food trucks. There's going to be stuff for the kids. There's going to be trick-or-treating. You do not want to miss this, and we have a link to the event. If you scroll down a little bit on our Facebook page, you can take a look. Also take a look at our fantastic surgeons who are going to be competing, and it just great time, great event. Please come out and join us on Sunday. So, and now that we've gotten past the fun stuff, let's get on to today's topic, which is the flu. We're here at Premier Pediatrics in Arnold with one of our newest clinics and one of our newest Washington University physicians, Dr. Julie Young.
Yes, thanks for having me.
We are so excited to be here with you today and to get to introduce you to everybody in our greater children's family.
I'm excited to be here.
And we're going to be talking about the flu today. So we're smiling, but we're crying inside because it's coming.
True, it is coming.
Yeah, so not here yet though.
Not here yet.
Okay.
Some trickling cases, but
okay.
Hasn't hit hard yet.
So you've heard it, not here yet, but it's coming. So if you want to get those questions in about what to expect this year or get a little refresher course on things that happen with the flu and things to watch out for, make sure write them in. We'll get to them, and we're going to try to cover everything the flu today.
Perfect.
So let's start with what actually is the flu and why is it so darn miserable for everyone?
So the flu is a highly contagious respiratory virus. It's transmitted airborne, and of course this is the season, this is the time of year that we typically see it. So it's fall and winter, typically peaks here between December and February, although every season's a little bit different. Sometimes we see cases into May. The symptoms are a little more intense than a cold. So you're talking cough, congestion, fever, body ache, chills, sore throat, sometimes vomiting, but not always. And so it's just a step up from the common cold.
And miserable, long-lasting.
Long-lasting. So typically symptoms will start 1 to 4 days after exposure, and then can last a good 5 to 7 days. So typically it's about a week.
Okay, a week. We've got our first question.
So one of our viewers wants to know, what is the best way to tell the difference between the flu and the common cold?
Okay, yeah.
Just from symptom standpoint, probably the intensity of the symptoms. So with the flu, often the fever's pretty high, and then symptoms tend to be a little more intense. So intense cough, the body ache is a little bit different than having the cold. And so if your child has symptoms that are more intense than just a runny nose and a mild cough, then it's probably worth an evaluation, especially in a younger child.
So when you talk about the flu and how is it spread?
So it's spread airborne. So just being near someone that might be coughing or sneezing, it's pretty easy to catch it.
Yeah, so that's why you push the hand washing and the hand sanitizer this time of year when we're all in close quarters and sharing our germs. Great. Have we heard about any predictions so far for this year's flu season?
We have not. Now, typically, the CDC helps us with those predictions. Once we start seeing some cases, then we can predict what strains we're in store for the season. Often a season will have 2 different strains of the flu pass through. The scientists will look to other areas of the world to determine what we're going to see here in the northern hemisphere, because flu's kind of winding up down in the southern hemisphere. So there's some predictions that way. Of course, nothing is perfect, which is why the flu vaccine isn't always perfect year to year, because it's a bit of a guessing game. But hopefully the flu vaccine will have good coverage this year.
So even though it's not 100%, the best way to start preventing yourself is to get the flu shot.
Correct.
So if it's not perfect, why is it still the best way?
So with the flu vaccine, you will start making antibodies within about 2 weeks. Now, there's 4 different strains of the flu in this year's vaccine, and so we're covered for hopefully the ones that we will see this season. If not, it's better than nothing because at least your body has started to make the antibodies, and so typically even if you get the flu, it's not as intense as it would be had you not gotten the vaccine.
So who should get the vaccine?
Well, honestly, everyone should get the vaccine.
Yeah.
But the high risk groups are certainly children under the age of 5, elderly, anyone over the age of 65, any pregnant women, anyone with any kind of chronic illness, be that asthma, diabetes, heart disease, and there's a few groups that should not get the flu vaccine, and that is babies under the age of 6 months.
Okay.
And then egg allergy, which is a little bit questionable. Many people with an egg allergy can still get the flu vaccine, but it just has to be in a controlled setting.
Yeah, I know. I remember whenever you fill out your form, there always is that,
Right.
are you allergic to eggs? And so I never knew that.
Right.
So for babies under 6 months, just still too little?
Too little, so we really rely on family members to be vaccinated to protect the infant. And then, of course, we have to monitor closely for any symptoms that might come up.
Well, is it true that you can get the flu from getting your flu shot?
You cannot. I hear that a lot.
See, that's a myth. It's not
It's
true.
a So it's not uncommon anytime you get a vaccine that your body will feel a little achy, maybe a low-grade fever, and so some people think that that's the flu, but what it is your body making those antibodies against the flu. So it's actually a good thing that you're feeling that way because it means that the flu vaccine is working. The other thing that could happen, unfortunately, is as you go to get your flu vaccine, you might pick up the flu in passing by someone that might have it because technically you're not going to be covered for a couple of weeks after. So
That would just be the wrong place, wrong time.
Right.
So, what do you tell people who go, my kid doesn't get sick all that often. They never miss school. They don't have anything like that. Can I just take my chances and not get them a flu shot, or maybe I won't get one? Is it okay to skip it this year?
So I would say it's so unpredictable, I wouldn't take the chance. There are some seasons that the flu strains are very intense and have a lot more complications, and it's unpredictable. So even in a healthy person, they could still get the flu each year.
Wow. So from year to year, it's different.
From year to year, the flu changes, right? Which is why the vaccine changes every year as well.
So I know we went over this a little bit at the beginning, but let's go over some of the symptoms again, especially for kiddos.
Right. So typically it's higher fevers and body ache, which of course the little kids can't tell you, but that usually results in extreme fussiness or being lethargic, not wanting to eat, congestion, cough. Some kids will complain of sore throat. And like I said, on occasion might have some vomiting or diarrhea associated with it, but that's not the bulk of the illness.
Because I think sometimes people kind of call the flu the stomach flu, and vice versa. They're
So
two
the
totally
stomach
different
flu
things.
is totally different, right? This is more of a respiratory illness.
And so how long can you expect symptoms in a child? You said around a week?
It's usually around a week.
Wow. So if I'm starting to suspect my child has the flu, can I just go ahead and treat him at home, or do you recommend just coming on in?
Well, so it depends. There are certainly some people that don't even know they have the flu and are just managing at home with things like Tylenol, ibuprofen, pushing fluids, rest. And if the symptoms aren't intense, that's perfectly acceptable.
Yeah.
Now, if the symptoms become a little more intense, where we're dealing with higher fevers or not drinking very well or maybe getting a little lethargic or irritable, then it's worth coming in so we can find out for sure. There is an antiviral medication that can be given to help treat the flu. It's called Tamiflu. It's not a perfect medicine, but it can certainly be helpful if we get it in the first day or two of the illness. Beyond the first 2 days, then it tends to not be as effective. And what it typically does is it shortens the course of the illness and can reduce the intensity of the symptoms. So that's an option. May not be an option for everyone. We certainly would push anyone that has any kind of underlying illness like asthma or diabetes or heart disease anything like that, they should be seen if they're having symptoms of the flu, because they definitely would be a good candidate to start the Tamiflu.
So you mentioned Tylenol and ibuprofen at home to treat. What about just as far as the importance of resting or staying home from school or daycare?
Right. So that's very important, because that's how it spreads, is if we're not staying home and recovering, then we are spreading it to others. So definitely recommend not returning to school or daycare until you're fever-free for 24 hours.
Absolutely. So some parents, I know I went through this when my daughter had the flu as a 6-month-old, kind of toggling between, can I wait till the morning to go to see my pediatrician, or should I just go to the ER and be seen right away, or to maybe the after hours clinic if you can? Where's the threshold on don't wait?
Right. So again, I think it depends on the individual child, whether or not they have any underlying medical needs, and then the intensity of the symptoms. So things that I would recommend going in for in the middle of the night would be fevers over 104 that we're not controlling with Tylenol or ibuprofen. Any type of breathing difficulty, so labored breathing or retractions, which is kind of pulling in the rib cage. Of course, if the lips are blue or anything like that, that's an immediate, ER referral. And then the other big thing in kids is dehydration. So a lot of times when kids are sick, they don't want to eat and drink. And so if they're getting droopy, if they're getting lethargic, lips are dry, they're not urinating, then those are all reasons.
So just so I know, if I went to the ER with the flu, what can we expect from the care team there?
So depending on the needs, so say there is a breathing difficulty, then sometimes they can do breathing treatments or provide oxygen if needed. Of course, if dehydration, then IV fluids can be given. And then if they determine that actually the child is okay to continue treatment at home, then they may decide to provide Tamiflu or not, depending on the situation. But at least it's a starting point if you're concerned that there might be a complication.
Good. And so I know the flu is something that goes around every year. We talk about it. We whine about it. It can, we whine a lot about it. I'm sure especially here.
Right.
So my question is, and as I'm trying to get back on my train of thought.
No, you're good.
So how serious can the flu really be?
Well, for majority of the people, the flu is not serious. So majority of people can get through it with the basics: rest, fluids, pain control, fever control. But there are a small percentage of people, and even healthy people, that it can progress to something more serious. And I would say probably the number one complication would be pneumonia. But other things can happen as well. So things like ear infections, sinus infections. For kids that have asthma, a complication from that, or diabetes. So anything that anyone with a chronic illness, the flu can certainly set that illness into effect. There are rare situations like myocarditis or encephalitis that could occur, which of course we don't see very commonly. But that's why if the symptoms aren't fitting the typical flu and seem to be kind of beyond what we'd expect, that's when you definitely need to seek care.
So I guess the final thing to think about is just, taking it seriously.
Right.
Getting that shot. And
right.
I'm sure
prevention.
For flu shots, you can come into your pediatrician's office and
this is the time of year.
Get it all taken care of.
Right. Good. Right. Ideally, we like to do our vaccines at this time of year. Like I said, that way the antibodies are in full effect when we start seeing some cases.
Dr. Young, thank you.
Thank you.
Thank you for joining us today on Mom Talks. This begins a new series for us on the fall, and so I hope that you'll come along with us. Next week we have a little bit of a fun topic. We're going to be talking about Halloween, and we're going to be talking about what to do if your child gets scared. I have littles, so I'm trying to stay away from scary movies and scary costumes and everything right now. And what do you do if you find your child hiding in the closet or hiding under their bed or coming and running to you and saying they're scared because they watched it? Don't tell your child it. That's a bad example. They watched a scary movie, or they heard a scary ghost story, or something happened while they were trick-or-treating and it's scary, wasn't fun. So we're going to be talking about that next week in our psychology department. Should be a lot of fun. Don't forget about Pumpkin Wars this Sunday, 1 to 3. Hope to see you there. And until then, we'll see you next week right here at 11. Have a great day.